Hello there. My name is Dr. Tolu, founder of St. John Cap, the Emotions Ambassador Program, and host of Walking on Eggshells with Dr. Tolu podcast. So today we're going to be starting season 2 of the podcast and also entering into a new year. And I wanted to remind us of what this platform is about. So I'm all about empowering youth mental health. I'm a child and adolescent psychiatrist, and I believe that one of the most important ways to empower youth mental health is by providing education to parents, teachers, caregivers, and the youth themselves. So on this platform, we'll be providing a lot of mental health education that will be relevant. I also believe that it's important for parents and carers of children with a chronic health condition, whether physical or emotional, to care for their own health, particularly their own emotional health. Like in the airplane, the air hostesses will tell us before you put on your own mask, before you put on your child's mask, put your own mask first. So, Walking on Eggshells with Dr. Tolu podcast is about helping parents and caregivers to prioritize their own emotional health. Having a mental health diagnosis or any chronic health condition diagnosis in a child takes a lot out of a parent. There is the grieving process, there's the questions, the confusion, the feeling overwhelmed. But it's important to know that you can help your child, but first you need to help yourself. So over this next season, we will be looking at caring for our own emotional health through different interviews. I'll be hosting different people. I'll be coming on live myself and talking about different topics. So today I'm just going to start out by saying that receiving a chronic health diagnosis in your child or a mental health diagnosis is not your fault. You have not done anything wrong. And there are many ways that you can help your child, but first I want you to help yourself. So remember, you have done nothing wrong. And I want to go through a couple of things that you can do to care for your own emotional health in the face of this diagnosis in your child. First, I want you to acknowledge the emotions that you feel, the anger, the confusion, the questions, the upset, the frustration, the grief at what your dreams and hopes may have been, the fear. It's important to acknowledge that. Then I want you to move on to educating yourself. We just won't stop at the point of acknowledging our grief and sitting in it, but then we need to step forward so that we can help our young person by educating yourself about that diagnosis. Find out all you can from credible sources. Talk to your healthcare professional, ask them for credible resources on the internet, books that you could read, support groups that you could get information from. Educate yourself on the condition, its treatment, its prognosis, options, what the journey ahead looks like at different age points, and so on and so forth. It's important to get information. After educating yourself, I want you to find a tribe. Find a tribe of parents who are going through the same thing. No matter how rare the condition is, there's another parent out there who's experiencing the same or something similar. So find a tribe. And you can even create a tribe. A couple of years ago, I was involved in researching mental health conditions that were caused by a rare genetic disorder. And in the country that I was working at the time, everybody I approached who was working in that field pointed me to a particular woman. Every hospital I went to, every database would say, have you contacted this individual? This was a woman whose daughter had been diagnosed with that genetic condition 25 years earlier. And she began a support group of mothers that became a nationwide support group. And whenever any research was going to be done into that condition, she was like a major gatekeeper because the hospitals, the researchers would have to access the database of parents or children with these conditions through her organization. She organized national conferences. She also attended international conferences for people, parents and children with this condition. And when I met her, her daughter was now an adult who also would host sessions during conferences for children with these conditions. So can you imagine what impact this woman's forming of a tribe had, had on this condition nationally and internationally? She made a difference. So find a tribe, and if you can do it, start a tribe if necessary. Then the next point is ask for help. Ask for help from your partner, your spouse, your family members, church members, neighbors. Accept help. We as women like to think we're superhuman. We think we can do it all. And so sometimes when people offer you help, you turn it down because you think they might not do it as well as you can. You don't want them getting too close or asking questions or demanding favors in return. But it's important not to overthink these things and accept help, where possible. So if somebody offers to look after your other children so you can have some time for your child with a particular health condition, please accept it. If they offer to babysit your child so you can get your hair done or have some me time or go on a date with your spouse, please accept it. If your spouse offers to help and you think, you may just bungle it, give him a chance. He will learn. So ask for help, accept help. That's important. Next thing is be kind to yourself. Take time to pamper yourself. It's tough to have a child that you have to care for and go to all the appointments with and be on the ball with their treatment. But take time for yourself, because if you don't do well, your child isn't going to do well. So take time to care for your health, and that might be, taking time to make sure you eat well, you exercise, you get as much sleep as as is feasible for your condition or for your situation. Take time to, if possible, get your hair done, get a massage, get your nails done, go away with friends if possible. Ask your family members to care for your children so you can get a night away. And if necessary, get formal help. If you find that your mental health is really being impaired, look for formal help. Go to your healthcare practitioner. You may need to go to seek therapy for yourself. You may need to even consider medication. How is your physical health? Are you getting all your health checks done? Are you getting your mammograms, your pap smear, all those things? Is your blood pressure normal? Is your cholesterol under control? These are things that we've discussed here on this platform. So feel free to go back to previous episodes where we've interviewed people who've spoken about how to care for our physical health, the health checks that we should have done and when. And then also, if you're overwhelmed with finances, having a child who is receiving medication, I'm not sure how you're paying for medication, how you're paying for healthcare providers. Finances can be a problem. Get financial help. Become financially literate. If you need to get a financial advisor on board, do so. Do whatever you can do to make other aspects of your life as healthy as you can. And so we've covered a lot of things in these few minutes. Remember, acknowledge your grief, educate yourself, find a tribe or start a tribe, accept help, ask for help, pamper yourself. And the last one is look around you. Sometimes when we have a child with a health condition, it really affects our relationships. We become so consumed by this child and their needs that marriages begin to suffer, siblings begin to be neglected, begin to feel resentful. Please bring your partner along, bring your spouse along in this process. They're grieving as well, they're struggling. Go on this journey together so they understand what you're going through, and hopefully both of you can support each other's needs. Take time for your other children. So if you can get help with this index child who has so many needs, that'll help you to connect with the siblings, help them to understand that their sibling has a challenge, but that they're also important too. Understand their struggles. You may need to get them some formal help if they have emotional difficulties because of the challenges with their sibling. You may need to take time out for their own activities, sports, what they enjoy. Be intentional about it. So look around you. Don't forget to carry other members of your family along. or to try and meet their need. You can do this. It is possible. Be intentional, be kind to yourself, take it one step at a time, and by all means, seek help if you need to do so. Talk to your healthcare professional. So I'm looking forward to the next couple of sessions in season 2. We've got so many interesting interviews, great topics. Please continue to follow me on social media, Instagram, on Facebook, on YouTube, and please listen to the podcast as well. Share this information with your network, and feedback is great. Would love to hear what other topics you think you would want us to deal with on this platform and how we could make things better. Thank you and see you again soon.